Hi, I'm Dr. Schneider. We're here at Goodyear Chiropractic, and this is Lisa. This is a patient of ours who's offered to let us demonstrate a procedure that we've been using on her that's been very effective and helpful to help relieve some of her back pain and radicular pain that she's been having. A little history for Lisa's head. Came in and approached when she came in how many weeks ago?
Probably about 3 weeks ago. It was just after the 4th of July.
She was in severe pain, was not walking very well. She actually presented with a cane, was having very severe right leg sciatica, low back pain. She has a past history of a total right hip replacement, which has really affected her biomechanics of her lower back. And since we've been trying to increase on the movement and mobility of both hips to not have her low back compensate so much and basically be tore up, and that's essentially what happened. We've cleared out the leg pain at this point, and we now are about 95% better with a little bit of lower back pain continuing. However, there's still this hip dysfunction issue. And one of the things we're finding is she has extremely tight hip flexors, and hip flexors originate in the front of the lumbar spine, come through the abdominal region and attach to the front of the femur, and they act as a supportive postural muscle as well as a hip flexor for movement. What we're going to do today is show you one of the procedures we've been doing, which is a very deep tissue release. And this is Erica, one of our manual therapists, who's going to demonstrate that release on her today. So
one of the first steps we take when we're going to do the deep muscle release is I'm going to have Lisa bend both knees so that her feet are flat on the table. And as Dr. Schneider said, the psoas muscle, which is a deep hip flexor, is deep inside the abdominal area. So I'm just going to locate the belly button right here. And then I'm going to work slow and deep inside the abdominal muscles, and you let me know if that's any tender or tight at all.
what Lisa's feeling is basically pressure through her abdominal area, directly on the muscle, which can be quite tender.
So that's about tender.
Yes, it is.
Okay, and how's the pressure for you?
It's fine.
One of the techniques that we can do to help release that muscle is called tense and relax. And I'm going to have you bring your right knee up towards your chest for me, just like that. And then you can let your leg go back down in the same position.
So when she's doing this, we're trying to proprioceptively inhibit this muscle. The muscle is overactive, not only due to its overuse, but also neurologically. So we're trying to retrain it to turn off, if you will. And so when she has her contract and relax, it's sort of tricking the nervous system to allow it to turn off and also then release the muscle. And so she'll go through a series of this, and she'll do it through different points of the actual muscle belly, and she can even get into more of the insertion around the iliacus. So that's it. That's the procedure. Thank you for your time.